Hi, doctor. So, ma'am, I feel so embarrassed to ask the things that is there inside me to a doctor. It feels so awkward and uncomfortable for me to ask the questions.
Okay, so today I'm going to address a very important issue where a lot of couples come to me and they have this inhibition. They kind of feel embarrassed to ask certain questions. So there are probably these 5 questions that I hear from my patients after much coaxing and counseling, that please do ask whatever doubts you have, however embarrassing it may be, because when you come for a fertility treatment, nothing is really embarrassing. So the first question that I get asked often is, are we having sex too frequently, or is it not enough? So there is nothing like having sex too frequently or not enough. When you're going through a fertility treatment, you can have intercourse as and when you please, just like when you're on other regular days. There are very few times that you should not be having intercourse, and your fertility doctor will be guiding you when those periods are. But other than that, there is no restriction on that. There's one more question that we get asked very frequently: is there any specific position which can improve our chances? So again, that's a myth. There is no specific position that you can have intercourse in which is going to improve your chances at having a pregnancy. So feel free to use any position, and that's totally your comfort. And then they also have this question that, will infertility treatment affect our intimacy? Will it affect our relationship? So no, not at all. Why should infertility treatment affect anything that a couple is going to have between them? If anything, I feel that throughout this treatment, the couple has to be together, and actually their intimacy must improve, because they are going to be each other's biggest support throughout the treatment, and that is very important during your infertility journey. There are many male patients who ask, is male fertility testing embarrassing, or is it painful? So firstly, it's not at all painful. So you'll have probably a few blood tests, and you'll have to give a semen analysis. Now, semen analysis, when a male patient hears that, they're very apprehensive, because the sample has to be given in the hospital. Will there be privacy? Yes, of course there's going to be privacy. You're not expected to just go into a bathroom and give a sample. No. So we have semen collection room where that room is separate. It's totally isolated. Nobody really goes there, and that room is assigned to you for as long as you want, till you're comfortable to give the sample. So no, it's not embarrassing, it is not painful, and please feel free to come and get yourself tested if that's required. And the last one that I want to address is, couples kind of, when they're going through this process, they come and ask us questions like, is it normal that we feel guilty that we are not able to conceive? Or we sometimes tend to blame each other for this. But this is something which is very important, and I want to address that. One is that nobody has to feel guilty that this is probably an issue where one partner is affected, because many a times infertility comes from both sides, and even if it is from one side, your support for your partner is what actually matters. So feeling guilty that you are at fault or blaming the other person for it is something that you should probably not be doing, because the couple is their biggest support for each other. So stop blaming yourself, stop blaming the other person, and the more you're able to actually do this together, the better your outcome is going to be. So I hope these 5 questions have addressed most of the doubts and the embarrassing questions that most couples come up with. If you have any more such embarrassing questions that you feel you don't want to ask your doctor or anybody around you, please feel free to DM me, and I will answer it for you.